Kybella versus liposuction, what should you do? Well, let's break it down a little bit. So the most common place Kybella is used is the submental region. So the fat under your chin, kind of between your chin and your neck. So how Kybella works is it is a substance that's injected into that fat pad, and the substance dissolves that fat, and your body then absorbs the dissolved fat. And that's basically how Kybella works. Kybella is not cheap, it's pretty expensive. I'm not gonna say the price on this video because it will probably change after this video is published, but it is not cheap, and it often requires multiple treatments for Kybella to have a desired effect. And the final outcome, even after 3 to 4 treatments sometimes, is somewhat underwhelming. Even if you look at the company's best before and afters, it's kind of a result sometimes. On top of that, there is a recovery period, meaning after Kybella is injected, that tissue becomes very swollen and inflamed, and you can kind of look like a bullfrog. So, in summary, Kybella is great in that it only requires injections with a needle, and basically anybody can do it that's trained to use Kybella. Liposuction, on the other hand, is my preference as a plastic surgeon for a few reasons. One is I know I can achieve a significant reduction in that area, in the fatty tissue here, because I am actually sucking it out with a cannula. Another advantage of liposuction is that it can be done in one treatment, meaning you don't have to have multiple liposuction treatments to have the area treated. And finally, this is what I think is one of the biggest benefits of liposuction over Kybella, is that Kybella does not break up the skin. Meaning it just dissolves the fat under the skin, and what can happen to some people is then they have this loose waddle of skin where there was once fat underneath, because that skin was never loosened up or allowed to redistribute over that area. So with liposuction, the skin is discontinuously undermined or loosened up so that it can re-drape and tighten up over the reduced amount of subcutaneous fat. Think of it like this. If you have a pillow under a bed sheet and you make that pillow disappear by snapping your fingers, there's gonna be a wrinkle on that bed sheet where there was once a pillow underneath it. If instead you remove that bed sheet and then you remove the pillow and then shake out the bed sheet, the sheet can lay flat again because the sheet has been redistributed over the bed and is no longer bunched up where there was once a pillow. So that is what liposuction can do, is it frees up all this skin, so once that unwanted fat is gone, that skin can re-drape and tighten up and give you an overall better contour of your neck. And finally, liposuction of the submental region or neck region is probably cheaper than multiple Kybella treatments. And that'd be the last point to make. And on top of that, liposuction of your submental region or neck can be performed under local anesthesia or numbing medicine. So before you spend a bunch of money on Kybella with your dermatologist or someone who can't do liposuction, I recommend you see a plastic surgeon to be evaluated for submental or neck liposuction under local anesthesia, because that may be a cheaper and more effective solution to solve your problem. To learn more, check out our website where you can upload your photos and concerns as a virtual consult. You can also check out our price estimator to get pricing information for all the various procedures we offer. And finally, if you'd like to have your questions answered on a future podcast or Q&A video session like this, please leave a message on our SpeakPipe. You can go to our blog page and our SpeakPipe is located there. Thanks for listening.